So here we go. Let's get started. So from the beginning, we are going to talk about getting old. And right now, I am going to use my excuse of getting old for thinking this started at 11:30. So thank you so much for being very patient for me. But we're going to talk about getting old with our patients and how we can prepare for what can go wrong as they start to get old or for the changes that we see. So as we look at these particular patients, when we talk about aging itself, that's basically once we are mature adults, these are progressive changes that happen after we reach maturity. These progressive changes are declines. They are decreases in how our organs function. They're decreases in our ability to heal. It's not just getting old though, because there are some patients that get older and stay pretty healthy. Some patients that get older and get some pretty significant illnesses. So we're going to look at the wide range of our older patients and know what we can do to help make them as healthy as possible. So generally speaking, as we look at trying to figure out how old our patients are, it's not as simple as saying, take their age and multiply it by 7. That way you get the relative age to people or their dog years. It really depends, especially in dogs, on their size, their height, and their weight. Cats and smaller dogs are a little more simple. Cats actually have a very distinct chart of their life stages that we'll go through in just a minute. With dogs, however, larger dogs age more quickly and they have shorter lifespans. Smaller dogs tend to have much longer lifespans. And in fact, we see some distinct differences in what we see as old age diseases between large dogs and small dogs at times. In order to try to figure this out, we have some good resources for us, including a comparison chart that looks at a dog's age and their relative age, their biological age, to figure out their relative human age. So when we think about senior, what we look at is what is a senior pet? So maturity, that's at about 50% of your life expectancy to 75% of your life expectancy, with that last quarter of life expectancy, or 25%, being considered a senior. Geriatric for some is when you've reached that life expectancy and survived beyond it, although some people consider geriatric pets as those that are senior, but with significant health problems. Certainly, there's going to be some differences between the size of the patient and even within specific breeds. Sometimes we'll have some specific breed life expectancy tables that we can look at, but when you have a mixed animal, it gets a little bit more challenging. And then even within those expectancy guidelines, small dog versus large dog, it certainly varies with the individual as how healthy they are and how quickly they age. So think about your dog, okay? So how old is your dog in human years? While this is a pretty busy graph, I think we can work with it. Take, for instance, I'm going to introduce you to Buddy later on. Buddy is at least 12 years old. Now, he is a rescue. He's a greyhound. We were told he was 2 years of age when we got him. And that makes him at least 12 and a half years old right now. Buddy is a little bit light at 58 pounds. So if we go over to the fourth column, 51 to 90 pounds, at 12 years of age, Buddy's relative human year age is 77 years. At another couple months, I think we're safe in saying that Buddy's around 80 years old. And bless his little heart, he's sweet, but he certainly is looking all of those 80 years at these days. If you have a very small dog under 20 pounds, then that 12-year-old dog will be around 64. Do you see how much longer they tend to live? And see where that grouping of senior versus geriatric versus mature is for these younger patients, smaller patients? Now with cats, it's pretty easy. Kitten, up to 6 months. Junior, up to 2 years. Prime adult, up to 6. And they talk about mature cats being 7 to 10 years of age. That means our seniorhood starts at around 11 years of age and geriatric at 15. So if you start looking at things like diet, stating that senior is 7 doesn't work out for cats or small dogs. But if we go back to our chart with that over 90 pound, a giant breed, senior, which is around 50 years of age, I know that's seems kind of young for me, but since I'm 60, I'll just have to accept it. 90-pound dog at 6 years of age is considered senior, 5 to 6 years of age, and geriatric at around 9 years of age. So giant breeds age even quicker. Now, of course, it's fun to work with kittens like the picture up top. And sometimes we talk about maturity. So this is my George, who's about 4. So he's a prime adult. Yes, we dress him up in funny things, and he's kind of a goof. So mature in years, not necessarily in personality, but that's why he fits my husband so well. The other thing I'd like to have you consider is years are good, lifespan is good, longevity is good, but it's the quality of life that is so important. So instead of thinking about lifespan, we need to think about health span. We need to make sure that no matter how old that patient is, no matter how small or big, that they are having a good quality of life. And that way we look at certain basic things. Are they eating and drinking okay? Are they eliminating without any discomfort and appropriately? Urinating and defecating where they should? Are they comfortable? Pain is a very important aspect of these older patients, and it's something we really need to pay attention to. Another thing we're going to talk about is, are they having fun? Do they still enjoy their family? Are they still aware of their surroundings? So let's consider health span, even more so than lifespan. So as they start getting older, what can happen? Very similar to you and me. And if I have some mature to senior people out there listening today, you know what I'm talking about. You youngsters, you'll find out soon enough. Certainly, our organs don't have the same capacity to heal or function. So we might have heart disease. They might have kidney or urinary disease. They might have liver disease. A good proportion of pets have some level of arthritis in their joints, in their bones. So getting around is a lot more difficult than it used to be. We might have weight changes, either a gain or a loss, and we'll talk about that in a minute. And then one important part for families is that cognition. Are they getting any signs of dementia? Are they having any problems that way? So we'll look at these things. To get ourselves prepared for these senior years, what we need to consider is, as they start getting older, they need more frequent care. As a senior pet, we recommend twice yearly physical exams. We want to make sure that we get the blood work and urine checked often. We want to continue their preventative medication and treatments. We want to monitor the condition of their body and their weight. And we can even put together a senior diary. So let's look at these things a little more closely. So physical exam with your veterinarian, at least twice yearly. Because if you're talking about these pets that age more rapidly, that's every 2 to 5 years for a human. And when we get older, we don't want to wait that long in between our exams. Because changes can happen quickly, but they can also happen gradually. So you might not notice from day to day that there's a change happening in your aging pet. The exam might show that more. Certain questionnaires might alert you to certain conditions to be aware of, whether it's nutrition or cognition, the way they're behaving, even elimination, and certainly quality of life questionnaires. When routine screening, blood work, urinalysis, blood pressure was done on apparently healthy senior cats. This was a study done back in 2013. No signs of illness, no complaints. Problems were found early. There was high blood pressure in 8%. Some had heart murmurs. Up to 29% were showing some decrease in kidney function. And in fact, back in 2013, before we had a test called SDMA, that meant that kidney function on these 29% of these patients was down to 25% of their normal kidney function. So that's pretty significant. That can produce a protein in urine. And then also we might see diabetes happening that can produce glucose in urine, high blood glucose, and in cats especially, increased thyroid hormone with hyperthyroidism. In dogs, it might be low thyroid hormone. So even though a cat may look pretty healthy, and these two here doing their yin and yang hug are my Spot and my Ella. Spot's still with me at 15 and a half years of age. Ella passed away at about 13 due to kidney function. So make sure you check them early, because the best chance we have of treating our patients is finding a disease in the early stage. Even though they're older, you definitely need to continue your preventative methods. They need their heartworm prevention given with an annual blood test. They need to have their fecal checks done to check for internal parasites, because just because they're old doesn't mean they can't get hookworms and roundworms. It's not just a puppy thing. And you may think vaccinations might not be as needed, but in fact, since their immune system can't fight diseases as well, we definitely need to keep these vaccinations up to date. Another prevention we need to look at is dental care. A lot of times our dental care is taking out really bad infected teeth. But to have the healthiest patient possible, you want to have preventive dental care. You want to get those teeth when there's plaque and calculus and clean them off before there's so much bone loss that you have to do a lot of extractions. And in fact, keeping a healthier mouth can really mean a healthier patient. Even when we treat those dental problems as they arise, they feel so much better after we get rid of the infection on all the problems in the mouth. And we certainly want to get rid of those problems before we have a problem such as a broken jaw due to the poor periodontal disease. Just like with us, body condition and nutrition is very important to watch as we start to get older. Basically, when you look at body weight and weight gain, we do have some factors that can play more of a role with these overweight patients. But weight loss, especially muscle loss, can be just as important. Diet certainly is very important in aging pets. What they're eating, how they are eating, and what they need to be fed. There aren't any specific senior nutrition guidelines by what's called AAFCO that has puppy guidelines, kitten guidelines, and mature adult guidelines. And just because a diet says senior on the bag does not necessarily mean it's the right one for your pet. Now, there's certainly a lot of people out there with a lot of different opinions, whether it's on Google or Facebook or even someone who works at the big pet stores. But the best people to ask about what's good for your individual pet is your veterinary team. They know what health problems your pet has, and they know what's best for your pet. One quick plug in here, please be very cautious about what we call the BEG. Boutique, exotic, and grain-free foods have been shown to increase the risk of cardiomyopathy in our patients. So ask your veterinary team. So what if your patient is too heavy? Certainly as we age, our basal metabolism rate tends to decrease. And then maybe we're not working out as much, and then that increases our risk of arthritis and diabetes. Now it hurts to work out. Now we start getting heavier. It's tough. Let me tell you, it's tough. Each decade makes it tougher and tougher on me. So we need to look at the diet. Do we need a lower calorie, higher fiber diet? Don't just look at the food you put in the bowl though, but how many treats are they getting? You need to add that to the calorie count. If they're not doing a lot of exercise, we'll talk about gradually increasing that. And if they're really big, fast eaters, there's some excellent food toys out there that you can use for feeding your pet that will help decrease the speed at which they eat, but it also provides some environmental enrichment. So it helps stimulate their brain as well. On the other side, too heavy is too light. What if they start losing weight? Make sure there aren't any dental issues. Check the mouth. Are there any gastrointestinal issues? Are they still absorbing the food? We can find some absorption problems. We can find lymphoma in the GI system, lots of different things. Could it be behavior issues? Have they forgotten where their food bowl is? Have they lost a little bit of their sight, hearing, and maybe even smell? Thing of it is, when we start losing disease excessively, especially the muscles down the spine, the lean body mass, that can be an indication that we have some significant disease, heart disease, kidney disease, even cancer. Now, cats at about age 11, instead of having a lower basal metabolism rate, their metabolism doesn't slow down, it actually gets higher. So they start losing weight as they age, but if it's rapid, then we need to find out what's happening. Another point we talked about earlier on was pain and discomfort. And I think this is greatly underdiagnosed in many of our patients. Sometimes they're sleeping more. See, oh, they're just getting old. Oh, it's tough getting up. Well, it's tough for me to get up too. But sometimes there is specific areas that they can have arthritis, and this chronic pain builds on itself to where it becomes what we call maladaptive or evil pain. Medication can be helpful. Here's Buddy. You get to see a picture of him now. He has his soft orthopedic bed. He's got his Rimadyl that he takes, and he takes a supplement that helps as well. There's even diets that have combinations of joint diets, sometimes joint and weight loss diets for those that are heavy and have arthritis. And then certainly there's many things we can look at when we look at helping the comfort of our patient. There are different groups that give rehab certificates that have pain medication, training in things such as massage, acupuncture, and physical therapy. You might ask what Buddy has on right now, and on his hip, this is actually an Assisi loop that works with electromagnetic pulses to help disrupt some of these chronic pain issues. Luckily, he's pretty quiet. He just sleeps there and I can put it on him. You can see the green light showing it's on. And 15 minutes later, he's had one of his twice a day treatments. So it has seemed to help him feel a little bit better. We've made an adjustment recently to an apartment, and he was quite inactive to begin with. And he's starting to feel a little bit better, hop around, although he has yet to chase the bunnies outdoors. So, keeping them mobile, continuing exercise, as long as there's not specific surgical issues that might need to be done, and you do need to be careful of any injuries. They can get cruciate tears just like you can. They can have hip injuries just like you can. But as you're looking at increasing their activity with you, do it in small amounts, exercise with them. That gives you enrichment time that helps their behavior, that helps their brain health, their well-being, and it helps reinforce this owner-pet bond. And certainly it can help keep the weight at a more level area. So what about these older dogs that really do have some issues, getting around, getting up, arthritic, and their medications help, but there's still a lot of changes there. There's a lot of things you can do for dogs with both osteoarthritis and cats, and even if their senses are less. So let's talk about the osteoarthritis and those slippery floors. Area rugs can sometimes be very helpful, especially in areas that the dog is used to getting around. Sometimes it's best to keep their area that they're in somewhat decreased, especially if you have stairs. That might be challenging for some dogs. There's a special toe grip called Dr. Busby's toe grips that are placed on the nail. You can see the picture right there. And they actually will help a dog get around on those slick floors. Now, I put the term moving furniture, and that's not for the ones who have trouble getting around. That's for dogs that start having dogs and cats having problem with their sight. Sometimes cataract surgery may be recommended. Sometimes they go blind and nothing can be done. You'll be amazed at how well they get around. I kind of say, just don't move the furniture too much. So working on stairs can be challenging. Getting up into vehicles can be challenging. There's some excellent ramps out there. There's even some good harnesses that you can use to help your dog get around, get up. If they're used to going out doggy doors, or if a cat has a litter box with a high side to it, you might have to adjust those for pets that have osteoarthritis, in addition to getting the correct medication and any other kind of treatment, such as the CC loop. One of the things that can really just be tough on a family is when you start seeing behavior issues with our older pets. Some do pretty darn well, but there are some that you know they're starting to have a form of dementia. They may stop recognizing you as much. Their routines may be difficult to follow, but it's important to keep regular routines as much as possible. They may be asleep a lot of the time. Sometimes there'll be sleep changes where they sleep during the day but awake during the night. Kitty cats will stay awake during the night and yowl a lot when they have cognitive issues. The key of it is, as we see these patients, we do a good physical exam, medical exam, make sure there's no issues medically. And if we can rule out any of the medical issues, then we know that there could be some issues with cognition. And there can be different things, from the disorientation to the sleep-wake cycle, to even the activity levels or interaction with people. Cognitive dysfunction syndrome, CDS, can happen in both dogs and cats. And there's a good website at the purinainstitute.com that has a very nice questionnaire that you can fill out to see if you think your pet is having more CDS, cognitive dysfunction, that disorientation, that interaction, the sleep patterns. Is their house soiling? How is the activity? One of the aspects that has been added recently, it used to be just DISHA with one A, but now it's DISHA with two A's, is anxiety. Because we found out that anxiety tends to increase as they get older. And if they have cognition issues, then it can get even worse. One of the areas that tends to really increase with older pets is separation anxiety. Part of that, they may not hear and see as well. They may get confused easily. They get more clingy. And I've really noticed this in Buddy as he's gotten older. Over the past few months, we've had a lot of changes. We sold one house, and my husband's actually living in the new house, and now I'm living in an apartment because I still have to go to work in 5 hours away. So Buddy's now in the apartment with me. And for the first week or so, there was some distress there. Luckily, I was home for the first few days. During this time, we have been using the Calmer Canine. You can see it here. He has the little vest strap on and the neck strap, and it looks like he almost has a little halo on. This is a different type of electromagnetic pulse that works with the brain itself, and in fact, there's been several studies with veterinary behaviorists. So Buddy gets this session twice a day, 15 minutes a day. And right now, with a combination of things, he seems to be adjusting pretty well. He doesn't take different medications very well. So this has been a good addition to his maintenance. So Buddy, he sleeps a lot, but now when he gets up, he does have a little spring to his step. In addition to all the things that our veterinarian team can help us with, I also recommend putting together a senior diary. So this may be a 3-ring binder. It may be a folder. I'd like to have a few pockets in there so you can keep all the instructions from different vet visits. Like to have a sheet that shows the medications they're taking and how often. And sometimes if they're on a lot of medications, you might even make up a little spreadsheet for each week to make sure they get the right medications at the right time. There are many different pharmaceuticals that can make a good impact for your patient, but getting at the right time is very important. Then every couple months or so, check out their weight. Make a quick note as to how well they're eating, how well they've been eliminating, and if there's any behavior issues. I also like, you can do this on your phone, you can keep it in, you can print them out if you want to, but take pictures for comparisons every couple months. Body condition scores, muscle condition scores, you can make sure you can kind of follow how that weight is looking. But also if you ever have a small mass or tumor that you're worried about, you can take a picture of it. In fact, put a penny or something for size comparison, and then 2 months later, take another picture, and if it's changed, bring it up to your veterinarian. Have them check it. That's called a tumor map. I like getting lots of pictures. As they continue to age, there's always the discussions we need to have. We talked about health span. We talked about them being happy, eating and eliminating, and being active without any pain. So when that lifespan is good, we have good quality of life. But when we need to see what's going on, there's several really good quality of life scales. One at the bottom of the page shows the Lap of Love quality of life scale. It looks at pain, it looks at appetite, it looks at how they're eliminating, if there's incontinence, how their mobility is, how their happiness is. It's a tough decision for a family to make about another family member, 4-legged family member. But I'm glad that we have that decision that we can make so they don't have to suffer unnecessarily. Now there's another app that you can get on your phone from graymuzzle.org that you literally go in and put in good days versus bad days. So Buddy's calendar this past week or so, he's had some neutral days, a couple good days. Those were the days that I was mainly home, so he's much happier then. We didn't have such a good day on Monday the 18th. He was really painful. He had trouble getting up. He had a couple accidents because his GI system isn't so great, but so far we're still, we're swinging somewhat to the green. We don't have too many red days. This helps out when you're really trying to make an objective decision. There will always be feelings, but if you start getting more red days than green days or even yellow days, it may be time to start having that discussion with your veterinarian. Lap of Love, in fact, is a community of veterinarians throughout the US that offer in-home assessment for care and hospice care, and then also euthanasias. So we don't want to end on a completely sad note. We want to continue the good communication between you as the pet parents and your veterinary team. Regular, frequent exams and diagnostics, good record keeping both with them and the ones you can take with your diary. No matter how old they get, they're always your babies, as this Doberman kind of shows that he never figured out he wasn't a lap dog. But they're such important parts of our lives. We do want to keep them as happy and as healthy as possible.